Go ahead, ma'am.
Good afternoon, everyone. This is Dr. Poornima Mathur, fertility consultant at Oasis Fertility, Vadodara. So आज हम जो डिस्कस करने जा रहे हैं, we're going to talk about preconceptional counseling. कि how do we prepare for parenthood? Do we need to consult a doctor beforehand? And how do we proceed about it? So let's starting with it. Just one sec. So, preparing for parenthood, the importance of preconceptional counseling, how to proceed. So, what is it basically? It is a proactive approach. अगर हम pregnancy plan कर रहे हैं, how to be sure that हम अगर कोई hurdle expected है हम उसको remove कर सकें. How can we optimize कि हम pregnancy के लिए prepared? That includes both physically, emotionally and mentally. So it is basically कि हम अगर कहीं किसी जर्नी पे जाने वाले हैं सो मेक अ एडिक्वेट प्रिपरेशन सो दैट वी हैव अ स्मूथ जर्नी वी हैव अ वेरी ब्यूटीफुल आउटकम एंड अ हैसल फ्री आउटकम सो इसकी इम्पोर्टेंस क्यों है व्हाई इज इट नीडेड so like if we say कि हमारे एज ओल्ड अगर हम पेरेंट्स देखें they would say कि fine we never went to a doctor but then they planned their pregnancy when they were in their early 20s. So it is needed to allow the couples to optimize their health before conception. आजकल हमारी जो lifestyle है, the stress, the chemicals that we are exposed to, the heating habits. So now that has majorly impacted our health and hence वो हमारी fertility को भी affect कर रहा है. So this counseling actually allows us कि हम अपनी हेल्थ को असेस कर सकें उसको ऑप्टिमाइज कर सकें सो दैट हमारा प्रेगनेंसी आउटकम हेल्दी हो एंड कॉम्प्लिकेशंस मिनिमाइज कर सकें now this preconceptional counseling is needed for both the couples both the partners both the husband and the wife बिकॉज जो बेबी है वो हमारा 50% दोनों से बनता है सो इट इज़ नीडेड टू इंश्योर कि दोनों हस्बैंड एंड वाइफ की गुड हेल्थ हो कोई भी पोटेंशियल इश्यूज हैं जो हमारी फर्टिलिटी को और प्रेगनेंसी को अफेक्ट कर सकता है उसको हम करेक्ट कर सकें एनी प्री एग्जिस्टिंग मेडिकल कंडीशन अगर हमारी है उसको ऑप्टिमाइज किया जा सके एनी मेडिसिन दैट नीड चेंज कोई मेडिसिन स्टॉप करना है कोई ट्रीटमेंट हमें पहले चाहिए दैट कैन हेल्प अस आउट and to improve the outcome of the pregnancy so that हमारे chances of miscarriages, chances of abortions, preterm deliveries और low birth weight babies इसको हम minimize कर सकें. So we know these are the reasons why we need it. Optimize health करने के लिए, risk complications reduce करने के लिए and fertility rate improve करने के लिए. So ये सारे benefits जो हमें मिलते हैं from a preconceptional counseling, it actually makes the couple more like confident in the journey, knowing when exactly what is the right time to plan for a pregnancy, what is the right method of doing it. Believe it or not, even in this era, I believe हमारे जो बहुत couples हैं, they're very misguided regarding what is the fertile period, regarding how to plan a pregnancy. एंड व्हाट फैक्टर्स आपकी वर्क लाइफ में आपकी ऑक्यूपेशनल उसमें क्या फैक्टर्स हैं जो हमारे इन चीज़ों को अफेक्ट कर सकता है हमारे प्रेगनेंसी आउटकम को so for instance if you are working in a factory where you are exposed to certain chemicals or high heats that can adversely affect the male factors ये हमारे स्पर्म्स जो होते हैं जो मेल्स में से हमारे स्पर्म्स आते हैं which contribute to the pregnancy उनके ऊपर मेजर एडवर्स इफेक्ट पड़ता है because of that occupational hazard if there is any pre-existing conditions like diabetes है या हम overweight हैं ये सब कुछ adversely आपके pregnancy outcome को affect करता है so once we have a preconceptional counseling it gives you a nice outlook कि what is the fertile period when to plan your pregnancy any supplements that are needed any precautions that needs to be taken any medicines say for instance if you have a pre-existing medical conditions उसको कंट्रोल करने के लिए से फॉर इंस्टेंस इट इज़ अ हाइपरथायरॉयडिज्म थायराइड हमारा बहुत ज़्यादा है अगर हम थायराइड की मेडिसिन ले रहे हैं हाइपरथायरॉयडिज्म की तो उसमें देयर इज अ मेडिसिन दैट इज नॉट अलाउड टू बी टेकन ड्यूरिंग द conceiving part and the medicine needs to be changed into a more pregnancy friendly medicine same goes for hypertension and diabetes as well so the preconceptional counseling जो है हमें it empowers us so that we can have a good healthy pregnancy outcome with no complications so when do we go and seek a preconceptional counseling so it is हम कहेंगे अगर कोई भी couple है who's planning to have a pregnancy who's thought about it they should come and consult a fertility specialist to know कि what is the is everything okay, is there any factor that is concerning in their health, any medications or supplementations that need to be added or altered. If you are having a regular treatment for certain medical conditions like diabetes, hypertension, hyperthyroidism, hypothyroidism, कोई भी मेडिकल कंडीशन के लिए अगर हमारा ट्रीटमेंट चल रहा है तो इट इज़ वेरी इंपॉर्टेंट दैट आप अपने फिजिशियन को या अपने एंडोक्रिनोलॉजिस्ट को आप इन्फॉर्म करो कि नाउ वी आर गोइंग टू गो अहेड एंड प्लान फॉर प्रेगनेंसी सो दैट वो चेंजेस कर सके मेडिसिन में, बिकॉज कुछ कुछ मेडिसिन हैं which when taken in the first 3 months of pregnancy can cause major harm to the baby. So it is very important कि अगर हमारे प्री एग्जिस्टिंग मेडिकल कंडीशंस है तो हम अपने डॉक्टर को कंसल्ट करें दैट वी आर गोइंग टू प्लान फॉर प्रेगनेंसी. नाउ वी थिंक दैट इट इज ओके, चलो हमारी एडवांस स्टेज होगी तभी हमें प्रेगनेंसी प्लान करनी है, बट कंसिडरिंग द ट्रेंड these days, the way हमारी fertility has been declining, of late we've been seeing very young girls जिनका हमारा fertility potential, that is हमारा egg reserves or AMH is on a major decline, or semen parameters majorly affected. So it is very important, if you are in an active relationship, you want to postpone your pregnancy or you want to plan your pregnancy. That is where you come and consult. You get an overview. Ki, okay, now if I'm planning to postpone my pregnancy for next 4 years or 5 years, we go meet the doctor, say कि please evaluate कि अगर मैं 5 years postpone करती हूँ, my egg reserves or my body is not like, it is not going to majorly affect my pregnancy outcome later. Or if there is any concern which needs correction or which needs to be addressed now, that can be affected. So, and if it is somebody who's at the age of 35 and or beyond, who've been recently married, so then it would be strongly recommended कि before you plan it out कि whether you want to postpone it for a couple of years or want to go ahead immediately, आप प्री-कंसेप्शनल काउंसलिंग अवेल करके अपनी हेल्थ ऑप्टिमाइज कर सको so that you do not have any issues later on. So preconceptional counseling is what basically? इसमें what do we expect when we go meet a doctor? The first is you have to go meet a gynecologist, preferably a fertility specialist जो आपको इस चीज़ में गाइड कर सके. सबसे पहला पार्ट आएगा अ डिटेल्ड मेडिकल हिस्ट्री. इट इज़ वेरी इंपॉर्टेंट कि हम यू डिस्कस ऑल दी सिग्निफिकेंट मेडिकल हिस्ट्रीज. कोई मेडिसिन आपकी चलती हैं, पहले कभी कोई प्रेगनेंसी हुई है, कोई आपकी सर्जरी हुई है, any drug allergies that you have, any medicines that you're taking right now, or any significant family history, like family may, if somebody has diabetes, hypertension, or thyroid disorders, or somebody has a history of early menopause, or any fertility. Now, for males, it can be okay, okay, fine, ma'am, I've seen my brother, they are also struggling with pregnancy issues. They have certain factors, the male factors. So that is where it should alarm you. Okay, fine, I need to go and seek a treatment. So detailed medical history given to the doctor would actually help to pick up कि हमारे क्या क्या factors हैं जो हमारे concerning है and which need evaluation further. Now, the physical examination. So it is very important both the husband and the wife or both the partners are evaluated for any infection, any other physical illness, any breast discharge, any local examination in males to assess the overall health. Now, then after a detailed history and a clinical examination for women who are more than like in an advanced stage, a pap smear, mammography would help pick up anything that needs urgent intervention. Now, investigations हमारे आएंगे, that would include a blood test and radiological investigations. So, blood test क्या? जैसे हमें आपका blood group पता हो, आप whether you are a thalassemia carrier or not, आपकी HP electrophoresis, hormones like thyroid and prolactin जो important हमारे होते हैं, your egg reserves, your sugar status, your insulin resistance, your HbA1c, glycosylated hemoglobin. That gives us an idea about how are you handling the sugars. Any hint of insulin resistance in your body, pre-diabetes or diabetes. Your egg reserves, your rubella vaccination, your hepatitis B vaccination. So these blood tests would help us know what are the factors which can majorly affect your outcome and if any needs urgent intervention. Apart from blood work, we would prefer going ahead with some radiological investigations. जैसे एक sonography or an ultrasound या scan जो हम कहते हैं. When done in a lady, it can tell us about the uterus. कोई पैथोलॉजी अगर है, कोई फाइब्रॉइड, पॉलिप, एंडोमेट्रियोसिस, ओवरीज कैसी है, एग रिजर्व्स हमारे कैसे हैं, ओवेरियन सिस्ट कोई अगर है कि नहीं है, दैट वुड नीड इवैल्यूएशन. Now, when we talk about the ovarian reserves, that is also assessed as a part of the blood evaluation in the form of serum AMH test. Now, why is it that important? Because अगर हमारे egg reserves low है, optimal है, कि ठीक है, high. So now when somebody has a low egg reserve, that is where we can actually guide the couple कि हमें pregnancy procedure जो है, ये planning of pregnancy needs to be expedited, and medicines can be started to help out with that. Now, if there is any uterine abnormality, अगर कोई छोटा सा polyp है, your local vaginal examination पे कोई infection है, that can affect your pregnancy potential and which can be corrected by a simple antibiotic course. A polyp can be removed and dealt with hysteroscopically. And if any fibroid which is there which can impact your outcome, so that can be treated initially and then the pregnancy can be planned. So, after detailed medical and physical examination, blood work, and radiological investigations. Now, when we talk about all these, the male partner is equally important. Checking for any STI, sexually transmitted infections, जो हम आगे transmit कर सकते हैं. Thyroids in the male as well, and a semen analysis. A semen analysis would give us an idea about how are the sperms, the volume, any infection if there is there any, and if everything is normal, they can be guided regarding how to improve the quality of the semen and supplementation with antioxidants and the fertile period. If there is any abnormality, that can be corrected by further evaluation and treatment. Now, the other important thing is after the detailed evaluation, that two things that we need to address is the lifestyle assessment and the supplementations that are needed. So, lifestyle may evaluation of the lifestyle factors is very, very important. Ki what is the kind of lifestyle? What are the exposures that we have? Do we have an active lifestyle? How do we eat? Because that is all going to majorly impact your health and in turn your pregnancy outcome. For somebody, so now when we talk about lifestyle, we're talking about we need an ideal weight. So अगर हम आपका BMI calculate करते हैं, that is हमारा height और weight का जो ratio हमारा वो होता है, the BMI needs to be in optimal health line. वो it should be less than 30 in order to conceive, to ensure that the pregnancy course is smooth. Now, obesity can impact the quality of both the gametes, can impact your fertility potential, and can have major impact on your course of pregnancy. So, it is very important if we are on that margin of overweight, we try to get into an optimal weight to ensure a smoother course. If there is the lifestyle, if we have drinking, smoking, any other addictions, vaping, or drugs, so they can majorly impact the unborn baby. So it is if there are any addictions, we need to cut it down, try to bring it down to minimum, or stop it with the help of medical aid if necessary, and then proceed with the pregnancy. All these addictions can affect both the male and the female for their fertility potential, and in turn, if in case you've conceived, it can affect the outcome of the pregnancy as well. For a husband who is into active drinking, active smoking, or other drug addiction, the sperms are majorly impacted, and hence first issue that we have is we have difficulty conceiving, and if we conceive there is a higher chance of miscarriage or abortion. Similarly with women, because the fertility is affected, the quality of the eggs is affected, and it can also affect the unborn baby. Now, a lifestyle, when we talk about the lifestyle changes, we need to have an active lifestyle, 30 minutes of workout at least 5 days a week. Focus on diet, which should be rich in fibers, antioxidants, cutting down the processed food, cutting down of excessive caffeine or tea that we take, any addictions that can be minimized, and opting for a more healthier lifestyle. Now, then comes the role of supplementation with nutrients. Now, there's certain like folic acid supplementation in women before planning a pregnancy helps in reducing any neural tube or any brain defects. So, you are assessed for vitamin B12 deficiency, vitamin D deficiency. So, now the supplementation with folic acid for somebody who's B12 deficient, the B12 and vitamin D can actually help prepare you for pregnancy better. If somebody is anemic, अगर हमारे blood की कमी है, that an anemia correction can ensure that your health is optimal for pregnancy and its journey. We've discussed the medical history and physical examination, that how is it important. The risk factors need to be picked up. If you already have a irregular cycle, if you have been previously diagnosed with PCOS, or you have heavy painful periods, that is where you need to consult early before you plan your pregnancies, so that they can be optimized before we go ahead with the fertility planning. We need ideal BMI. If somebody is hypertensive and on medications, the medicines need to be changed and made more pregnancy friendly. And the medical history and physical examination help a lot in making out what changes need to be made. Because if you ignore it and you've been taking a medicine that is unsafe in pregnancy, that can actually lead to a lot of discomfort and problems later on. We will discuss the investigations that are needed, the blood work, the hormones, thyroid, prolactin, screening for any sexually transmitted infection in both the partners, an ultrasound to assess the uterus and the ovaries, and a semen analysis. We've already discussed them in detail. The lifestyle changes, maintaining a healthy weight, balanced diet, which is needed, which it boosts your fertility, physical activity 30 minutes 5 days a week, and avoiding all the addictions and recreational drugs. So now we have to say ki, we have to keep this in mind. We say ki, okay, we have a healthy lifestyle. Why? What would happen to my fertility? It's this, like, why do I even go and consult? Now we have to remember that we cannot ignore the toxins that we're constantly exposed to in our environment, the chemicals that are used in the vegetables or the plastics or the environment में जो है, so they have an impact. And we've seen of late, we've been witnessing a lot in our patients regarding the impact in young couples it has on their fertility. Stress, an additional factor which it is hard to ignore, which has become an integral part of our life. So young couples are working with their career, their focus, they're managing it with difficulty. So it is very important that when we are going ahead with pregnancy, we are going to plan for pregnancy, we start managing our stress, a work-life balance that we talk about. Our work offices settle down, and now we can actually focus on ourselves or our personal space where we have scope for going ahead with pregnancy. It is important, the medical chronic conditions that we've discussed already. And assisted reproductive techniques can, now if somebody has a very strong genetic history of certain medical illnesses, or that both of us are thalassemia carriers, we don't want that to happen to our baby, or we are concerned. At times what happens is a couple has seen something odd or something untoward happening around them, and that what scares them from having a pregnancy. What if that happens? So in that case, you can always come and meet us regarding, say, for instance, a couple has thalassemia, they've seen a family with somebody having thalassemia or sickle cell, and they're carriers. So there are different methods by which we can actually help you out to eliminate that genetic factor from your pregnancy. So it is in order to summarize, let me tell you that preconceptional counseling is actually the need of the hour. If you're young, you're married, you're settled, if you want to have a pregnancy right now, or you want to intend to delay it by 3 to 4 years or something like that, it is very important that you meet your doctor, get yourself evaluated, and get a very good idea about how to proceed about in your particular case. What is the health? And always remember, both the partners contribute equally in a pregnancy. So it's not only the lady that needs the counseling, or it is the couple that needs the counseling and evaluation to ensure. Thank you so much. If you have any queries, please feel free to contact on the following number. This is Dr. Poornima Mathur. Thank you so much. I think we don't have any queries. What are the important elements of preconceptional counseling? The important elements would be a detailed history, a physical evaluation, and the investigations, both the blood and the radiological, if needed. Thank you so much. Please contact us at the given fertility helpline number. This is Dr. Poornima Mathur from Oasis Vadodara.